The self-quarantine measure, which was adopted by the Ministry of Public Health in the early stages of the COVID-19 outbreak in Guyana, required anyone who came into contact with persons tested positive for the virus to remain indoors for at least 14 days. While these high-risk persons may not be showcasing any symptoms, they were reportedly being monitored by healthcare personnel who made routine calls and checks on them. Persons who exhibited COVID-19 related symptoms were taken to one of the ministry's 4 isolation areas to be monitored closely. However, Minister of Public Health Walter Lawrence told media operatives recently that the self-quarantine methodology will no longer be in place.
Now that we have those 4 facilities up and running, and so as of today, any new suspected case, any new persons that would have been in contact or in an area where we suspect that they may have been exposed, there is no more self-quarantine. All quarantine will now be done at the Ministry of Health facilities.
The minister revealed that this modification is being implemented in the wake of several negative reports that the persons who have tested positive have been breaching the self-quarantine guidelines.
Yes, we have had 2 sets of reports. We have reports from the public where persons have made those allegations, and then we have reports from the family members who are saying that it is not so. Notwithstanding that, as you've heard very clearly from Lieutenant Colonel, that we do have within our structure that mechanism to ensure that we track.
Guyana's first confirmed case last week was that of a 52-year-old East Coast Demerara woman who had recently traveled from the United States of America. The woman succumbed to the disease. The dead woman's relatives, including her husband and son, are now being closely monitored at an isolation center. Meanwhile, Deputy Chief Medical Officer Dr. Karen Boyle had recently revealed that the National Public Health Reference Laboratory had limited supply of testing kits. Lawrence, when questioned by reporters on this issue, assured that despite a delay in the arrival of the testing kits from overseas, the crucial medical instruments are expected to arrive in a matter of weeks.
The delay has to do with many of the countries closing their ports and their airspaces and so on, but we'll be having enough test kits, we have enough supplies to be able to address the situation.
The ministry has managed to secure 4 isolation areas around the country with an overall capacity of 400 persons. Stringent measures against the spread of the virus, such as the closure of the airports to international flights, have also been put in place. Temika Rodney reporting for HGP Nightly News.